Okay, let's have another one. Italy's hard-won success in controlling the epidemic. Indeed, and these are the figures for Italy. These are my forecasts from March the 17th to March the 28th on what is, as I mentioned, the more pessimistic curve. All between, well, that highest one was 395,000, lowest one was 234,000. But they are coming now towards about 225,000 more recently as I've gone into April. And the optimistic forecast is actually a little bit better than that. And so there's Italy's trend line, which I showed you in the last video before my camera interrupted me. Now this is quite interesting. This is like the cumulative cases over time, from the beginning to the end of the epidemic. And basically it accelerates and accelerates. It goes into a kind of linear region, and that's when the slope is steepest and you get the peak new cases per day. So you get the peak of the epidemic here. And I think that's when the R0 actually goes to 1. So you've got people spreading the disease to a lot of people, to slightly more than one person. You put some restrictions on. Then when the social distancing's come in for a couple of weeks, you start to get the cases going up in a straight line, which means you're getting no acceleration anymore. That means that basically one person is giving the disease to one person. You've got it this week, somebody else has it next week, essentially. And then it decelerates as the R0 gets to less than 1, a lot less than 1, and hopefully in the end 0. Okay, hopefully in the end 0. And the percentage change during that time in the deaths goes down, and in the cases goes down towards 0. Okay, and it has to get to 0 to get to the very end of that curve on the right hand side at the top. And that's the new cases. Okay, so with R0 greater than 1, a lot greater than 1, it's accelerating upwards. Then as it gets a little bit, it gets lower, it gets a little bit over 1, you're still expanding the number of new cases per day. When it gets to 1, the number of people infected is kind of constant per day, and it starts to decline as you get less than 1, and as you get a lot less than 1 or 0, it goes to 0 new cases a day. Well, it doesn't actually, because you get additional clusters, but let's just say in theory it gets to 0 cases a day, and there's the death curve, which lags just slightly behind. And this is a forecast death curve. This isn't like some model or something. This is the forecast. And this is where I'd actually said they'd have 938 deaths on the 5th and 6th of April. And they have 6,685 cases on the 2nd of April. And that forecast was pretty close. It was pretty close, actually. In the end, they had about 6,500 cases for one day and 6,000 for 3 days, and they came down this curve and actually started to come down this more optimistic curve that I created from the last part of the trend, which is a bit steeper. But it's kind of halfway between the two, really. So that's between 175,000 and 221,000 cases for Italy. Spain, again, their forecast peak was about 9,000, and that's what it was, you know. Although that says Spain, it's actually France. Their peak's a lot more volatile, but you can see, yeah, it's not bad with the forecast, actually. I think that's about okay. UK, we're climbing up one of these two curves. They're not quite as huge as the curves that I showed before, but there's a very daunting deaths curve, which implies possibly more than 2,000 new deaths per day at the peak if we don't improve. Okay, if we don't improve and up our game, if we let idiots walk about and piss about in the park and stuff because they feel like it. So here are my forecasts for Italy for now, for 8th of April. Pessimistic forecast, optimistic forecast for Italy, 175,221. A different kind of trend forecast, 204,000. The deaths, 25 to 26,500. United Kingdom, 550,000 to a million, 1.1 million cases, possibly as many as 160,000 deaths on the current trend. I'm not doing an optimistic and pessimistic at the moment because this is the more recent points anyway, so this is really an optimistic forecast. A few days ago, 4 days before that, on the 4th of April, it was 1 million and 2 million and 600,000 deaths. So that was huge, huge, huge. I also calculated from the new cases, taking 14 days of new cases and dividing it out by a number, taking 42% of this curve and then 16% of that, and this curve being added up over the last 14 days. People in ICU for 14 days, this is our base capacity, and it goes a bit over the base capacity to 8,000 beds. Okay, the pessimistic forecast, it goes to 13,000 beds. Okay, now we might have that many, but remember they're going to be localised in the cities and they might not be where the sick people are. These are the epidemic curves of daily new cases, pessimistic, optimistic for the UK versus Italy, Spain and France. Italy in purple. So this blue line is us compared to Italy in purple, you know. And this is how we're doing so far. I thought the trend was changing around about the 6th of April, but it didn't. It didn't. It went back up again. So that was a false dawn. And that's what our deaths look like compared to my forecast. Climbing up the wall of death, so to speak. And the cases climbing up the wall of worry. And there's the death curve just to compare. But I mean, it's following the forecast very closely right now. Okay. Let's just quickly go to something else. To do with ICU bed usage. Okay. Now, ICNARC, Intensive Care National Audit and Research Centre, publishes these things. This is their clinical bed usage for the last 3 weeks. Okay. And here was my forecast curve. Optimistic and pessimistic. Now that's for the day before, okay, because they were reporting for the day before, 4th of April. So that's the 3rd of April. I was a little bit high, and that's the 4th of April. A little bit higher than what they were saying that they had on the 3rd of April, but not far off. And I'm forecasting 3,500 and 6,000 beds to be used by the 11th and the 18th of April based on those curves there, okay.